Hi, my name is Mackenzie, and today I will be discussing methicillin-resistant Staphylococcus aureus, or MRSA. All right, so here is a copy of today's agenda. Today we'll be talking about what MRSA is, what the infectivity and pathogenicity of MRSA is, who's most at risk and susceptible to infection, why this agent is a cause for concern, where testing should occur, and how staff in the community will be protected from infection. All right, so what is MRSA? So MRSA is a type of antibiotic-resistant bacteria commonly found on people's skin. It's typically harmless. However, sometimes it can cause serious staph infections that can lead to sepsis or death. And due to its antibiotic resistance, these can often be difficult to manage and fatal. And it can also lead, in some cases, to the development of pneumonia or other bloodstream-related infections. All right, so in terms of MRSA, there's two types. There's healthcare-acquired MRSA and community-acquired MRSA. These types are genetically different, with healthcare MRSA being more prone to having people develop more serious infections such as bloodstream infections, pneumonia, other respiratory issues, while community-acquired MRSA is more likely to lead to the development of skin scalp infections, and MRSA tends to be 1 to 10 days after exposure. And in terms of the transmission routes, it's commonly spread by either skin-to-skin contact with someone who has active infection. If someone does not have an active infection of MRSA, it's unlikely to spread to other people. So an active infection needs to be present for skin-to-skin contact to cause issues. Touching surfaces and items that have MRSA bacteria on them, and also sharing used personal hygiene products with others. So in terms of signs and symptoms for healthcare-acquired MRSA, some signs and symptoms include rash, muscle aches, chills, fatigue, fever, cough, shortness of breath, and chest pain. And for community-acquired MRSA, some signs and symptoms include a swollen, painful bump on the skin. This often looks like a pimple or a bug bite and has a white or yellow center. And then it will also have cellulitis and pus near and around and on the infection site. So, who is most at risk and susceptible to MRSA infection? Well, everyone is susceptible to developing MRSA infections. People who have open wounds, athletes, children who attend daycare, military personnel, school-age students, individuals who are hospitalized, and individuals who have undergone surgical procedures are at higher risk for contracting MRSA. And then also in terms of healthcare-acquired MRSA, if you have recently had a surgical procedure, had a medical device inserted into your body, or if you regularly get drug injections, you are also at a higher risk for developing healthcare acquired MRSA. And also, if you are someone who engages in activities regularly where there's crowding and skin-to-skin contact, you are also at more at risk of developing a MRSA-related infection. All right, so why is MRSA a big cause for concern? Is mainly due to its multi-drug resistance and also its antibiotic resistance. Due to this, it's very hard to treat and manage, and so it can be fatal in some cases, especially in the case of healthcare-acquired MRSA, since it's really hard to manage and treat bloodstream infections and pneumonia caused by MRSA. So where should testing occur? So for healthcare-acquired MRSA, testing should occur within the healthcare setting. It should be a standard practice after any surgical procedures to do MRSA testing just in case. And then also staff should be tested within the healthcare setting just to help prevent the spread from going out into the community. And for community-acquired MRSA, if there's 1 or 2 incident cases and not a big outbreak, then individuals should make an appointment for primary care providers to be tested. However, if there's a bigger outbreak, then testing should occur at local schools or local community organizations that have sterilization techniques set in stone for after testing occurs. So how will the staff and community be protected from infection? So for the community, there's a lot of things people individually can do, including doing proper hand and body hygiene, cleaning and disinfecting shared items and surfaces regularly, keeping wounds, cuts, and scrapes clean and covered until they're healed, and avoiding sharing personal items, especially personal hygiene items. And in the healthcare setting, staff will be provided with personal protective equipment such as gloves, gowns, and masks when caring for MRSA patients. MRSA patients will be placed in quarantine to help contain the spread and to ensure people who do not need to be exposed to them are not exposed, and also to engage in proper hand and body hygiene. All right, so that was my presentation. Thank you so much for watching, and please reach out if you have any questions.